our intention here is to try to show the integration of radiotherapy in the National Cancer Control Program, the way that City Cancer Challenge has been working on this. Of course, City Cancer Challenge was not created with this objective, but we have been seeing that through the process, and you will see also, one of the way to reach one thing that we has been for many years trying to ensure that the countries include in the cancer control plans the radiotherapy development plan. So as part of them. So next one, we are going to have 3 presentations in one. We are with 3 people. I'm thanking all of the 2 of them for sharing the time for being with us here in the presentation and the experience in the city, which is the most important part. My part is only the introduction of city engagement process, how City Cancer Challenge has been working. I'm Rolando Camacho, global technical lead of CCAN. But the most important component of the presentation is the experience from the person who was leading the project in Myanmar, in Yangon City, which is the president of the Myanmar Society of Radiation Oncology, Professor Kim Cho-win. And it's the bottom-up approach in the project execution in the city. And then it will be closed, this presentation, by Dr. Thet, who is Technical Assistant Officer now in CCAN, but he was the person in charge of a City Cancer Challenge project in the city of Yangon. And he will talk about the strategy for local buy-in and implementation, which is a very important and probably, in my opinion, the most important, since you can prepare anything, you can prepare the documents, plans, or whatever, but you can keep that in your desk, or you can implement it. Next one. City Cancer Challenge was launched by the UICC in 2017 in Davos, and it was established as a standalone organization, foundation, in 2019. Next one. The mission is to support cities around the world as they work to improve access to equitable quality cancer care. And every word here has a meaning, because it is important for us to identify that we are not taking projects to the city. We are not implementing projects in the city. We are supporting the city when they work in their projects, what is identified by them. And also the main scope of our project is in relation to cancer care, in the quality and the access. Next one. What is the model, or the top things in the model? Well, first is the human-centered project design for that, and it's focused on testing and adapting. So we have been selecting few cities in different regions. In this case, Cali, Asunción, Yangon, and Kumasi were the first called key learning cities, because they were used to learn how to work in this condition, in this new way to work with the cities or with the countries. No? So this experience from one city to another was transferred, but also now the experience for the 4 cities has been transferred to the new bunch of cities has been incorporated in the City Cancer Challenge. And then this is the approach: test and adapt. We have to learn from what is has been happening in the cities, how we are implementing that, and also is we are focused on resource-constrained environments. Also, early learnings, as I was saying, for instance, what we learned in Cali, was the first city, was applied in Asunción. But then, when we went to Yangon, also all those experiences were applied there, and then for Kumasi. Also, it's important to see that the plan and the execution of the projects respond to local priorities in the area of focus, which is cancer diagnosis, treatment, and supportive and palliative care. And then incorporate key elements of the existing implementation science framework, which is very on top now, but I think that this is one example of what is implementation science means. and also draws on the systemic way, wide, inclusive, and collaborative approach. So we are, have been involving all experience from other projects, like for instance, HIV or so. Next one. This is a I will say like a phase. I will describe the pre-implementation, which is take 1 year and a half around that, and this is the diagnosis and planning. This is the process of due diligence for the selection of the city who apply. It's a very large process, consultation with different partners, organizations, and everything. And then the stakeholder engagement, I will go through it in more details, the need assessment, and the action planning and project development. This phase is just to prepare everything for doing things. And then the action and monitoring is the second one, which is around a year. And then is a project implementation, those projects who were developed in the previous phase, monitoring, evaluation, and learning, and technical cooperation, because it's at the moment that we support the cities with our partners, providing technical cooperation. And then after, because the period of SICAN in the city is directly involvement is around 2 years now. And then after that, there is a sustainable partner who will take over and will keep on monitoring evaluation, and then developing the city council network, and also the sustainable partners in different ways. Every city has different experience in trying to do this. Next one. This is where we are in the world in this moment. Apart from this 4 key learning cities that we have been mentioning, we have also in Latin America, we have the city of Porto Alegre, who is already more than a year now working on the development of the projects, and León, who is starting recently in Mexico. We have Tbilisi in Georgia, and we have Kigali in Africa, plus Greater Petaling in Asia, which is in Malaysia, which is now also a new city. Next one. I would like to highlight in these pillars of our stakeholder engagement, because I think it's essential. We don't go there to work with one institution or with one organization. We want to work with the city in general and everybody who represents the city. And for doing that, we signed a memorandum of understanding with the authorities, with always is a civil society organization participating, but also different components of Ministry of Health or so. And then it is created a city executive committee. This brings people who are really decision makers in the city, including people from the Ministry of Health, from the public centers, from the private centers, from the NGOs, from the academia, from different components, and patient representative also. And then this executive committee create the city technical committee for covering all areas of cancer care, from diagnostic, pathology, radiology, all the 3 modalities for cancer treatment, palliative care, etc. And then every member of the technical committee create a technical working group based on the number of institutions who are participating and all the specialties. No, they are the one who do the city need assessment to establish what are the gaps, the main gaps, and the capacity that we have, but also to identify priorities, because the gaps are many, the needs, the challenge are many, but they have to identify priorities. Normally it's around 12 to 15 maximum. And then with this, they develop the realistic action plan. Next one. Well, this is some figures to show. First, I would like to talk about City Executive Committee members. In total, in the 7 cities that has been already implementing, we have more than 100 members. 125 institutions has been participating across the cities. I think it's the 7 cities. Sorry, we have 9 now, but in this number is for the 7 first cities. And then 151 technical committee members with healthcare professionals involved in this assessment is 1,300, and more than 70 projects has been prepared by the city, involving more plus than 70 partners, technical partners, associations, many of them, has been in all the projects in the city. And this covered a population or reached a population over 43 million. Next one. These are the most common priorities that we identified in the city, or the city identified there. So we can summarize it here. Well, for multidisciplinary approach, quality pathology diagnostic, quality cancer surgery, supportive and palliative care, standardization of cancer care, essential oncology medicine, healthcare professional development, but one of them also was access to quality radiotherapy. And this is the one we are going to refer. Next one. What are the guiding principles for the implementation? We tried to deliver in the way that the citywide experience can be scaled up to a national level, and it has been happening. And the example of today is a city that what they have developed has been adopted as a national project, and create, of course, multidisciplinary teams of local experts. This is a lot of value. We have been insisting in the value of having teams at the city level who are really recognized by the rest of the group and works as the team. Build on available evidence and resources that they are available there. Promote an interactive local peer review process, because the city consultation, which is not only what is developed by the technical groups, is final, but it goes to the city consultation and then international consultation. Aligned with international quality standard and best practice, because the reviewers, the people who is provide, the experts who are provided by the partners do that. And leverage on partners, products, and expertise. And also enforce implementation of city outputs through CCAN, city executive, and shaping the policy. Next one. In radiotherapy in particular, 73 radiotherapy professionals were involved in these 4 key learning cities. The other cities are ongoing now, they haven't finished, and 12 facilities has been participating in the development of these radiotherapy projects. It's from one facility, for instance, this is the only one in Yangon, in Kumasi, 3 in Yangon, and then the others in Cali and Asunción. Next one. And this is the way that the methodology that we have been using with the cities to work in the projects. So first, to set up a project team, it's important to have everybody who should be is included. This group is the one who developed the draft zero. This is the project team is a small group. You don't have a large group to be really effective and functional. They develop the draft zero of the documents. They develop then a draft 1 to be discussed with the international partners. But this draft 1 is the result of the city consultation. So this small group who developed the draft 1 presented to the rest of the specialists in the city from different institutions the maximum number that is possible, and then they get the feedback from the city specialist. And that is the draft 1 that is going to the international consultation. Nowadays, in the way of virtual international consultation. And then based on the discussion with the international experts, is the development of the final draft. International experts are nominated by different organizations, like in this moment is IEA, sometimes the industry, and sometimes we are waiting for ESTRO nomination also to be incorporated in the future. Then it goes to the approval and endorsement, and then the dissemination. That is the example is going to be given by my next colleagues. Next one. And I give the floor to Professor Kim Cho-Win to present the experience directly in Yangon. Thank you.
Hello, good afternoon, everybody. I'm the Professor Kim Cho-Win. I'm President of the Myanmar Society of Radiation Oncology. It's project coordinator of CCAN Yangon Radiotherapy Project. So I will continue my presentation. As you all know, Yangon is the next slide, please. Yangon is the third key landing city of the City Cancer Challenge in 2017. After setting up the multi-sectorial City Executive Committee, which is composed of the leaders, decision makers in cancer care from government, public, private, and the patients' organization in Yangon, the need assessment was conducted in 2018. The data was collected in three institutions with radiotherapy facility in Yangon City, and 9 radiotherapy professionals were involved in the data collection process. Next, please. The major challenges identified in the need assessments in Yangon are: one is lack of the quality facility, adequate facility to provide radiotherapy services, including specialized equipment and IT development in public hospitals. Two is the limited healthcare professionals. Ratio between the high number of cancer patients and the limited healthcare professionals and facilities are leading to poor quality of oncology services. That one is a oncology radiotherapy service availability is a very limited in public sector, which is only exists in Yangon General Hospital. Next, please. So to address these challenges, a project to increase access to quality of the radiotherapy service in Yangon was implemented in 2019. To develop, our aim is to develop, our output is to develop the radiotherapy development plan and quality assurance program. Next slide, please. Based on the guiding principles of CCAN, as presented by Dr. Rolando, the radiotherapy project in Yangon is being executed in the framework of milestones, which are standardized in the logical sequence based on the accumulated experience within the CCAM cities and or from the international community. So very first step is to set up a project team with the involvement of radiation oncologists, medical physicists, radiotherapy technologists from both public and private sectors in the Yangon. Next slide, please. Whenever available, it is strongly recommended to engage National Liaison Officer of IAEA and Nuclear Regulatory Body of the country. The project team is led by a project coordinator who oversights the project implementation, provide the technical guidance to the project team, and coordinate with the city stakeholder to engage in the activities of the project. Next slide, please. The project team work together to develop draft zero radiotherapy development plan and quality assurance program. This is the critical step in this project to kick off the sequential activities. This diagram depicts the steps involved in the designing intervention in draft zero output, which takes in the average of 2 to 3 months to complete. Next slide, please. Firstly, the project team assessed the situation of radiotherapy services in the city in terms of catchment area and availability of radiotherapy services and human resources. In addition, the capacity of current resources are re-evaluated. Then, the project team reviewed the reference documents on the demographic characteristics, epidemiology of the disease, and methodology of the intervention. Benchmarks for the tailoring the intervention were also reviewed. The international benchmarks are adopted in local contents. Based on the findings in assessment and review, the intervention in Yangon is designed as a 10-year strategic plan, infrastructure, equipment, human resources, capacity building, and quality assurance, with short-term 0 to 2 years, medium terms 2 to 5 years, and long-term 5 to 10 years. So adaptation of international benchmarks into the local context is and is very important in this area. Next slide, please. The next step is to develop draft 1 upwards, which is happened 1 to 2 months after developing draft 0. The draft 0 upwards were consulted with the city experts in the city consultation workshop to verify the methodology and level of resources in accordance with the local context. It is important to share the draft 0 outputs with city experts at least 1 week before the city consultation workshop. The advice and the comments during the city consultation workshops are accommodated, and the project team conducted follow-up discussion to develop draft 1. The key message in this step is the tailoring the scope to the city's need. Next one. So thank you very much. This is all my presentation, and I will hand over to the Dr. Thet. He will be continue our presentation.
Thank you, Professor Kim Cho-Win. So I will continue about the presenting about the process that involved in this project. So next slide, please. Well, once the draft outputs were completed by the project team, so the international consultation workshop was organized by inviting the external experts nominated by the partners of the City as a challenge. So in this workshop, the draft 1 outputs were reviewed by the external experts to align with the international quality best practices and the benchmarks, and to collect the final recommendations to finalize the outputs of these projects. So these steps usually require about 3 months to be completed. So next slide, please. Here, I would like to present about the rules of the participating institution in this international consultation workshop. So the role of the SICAN in this step is to provide the technical cooperation support to the city project teams. So I would like to highlight here about the learnings of the city-to-city exchange support of SICAN. So this is one of the project team member from SICAN Ascension City. So provided on-site support to the Yangon project team by sharing the similar experience and the key learnings from the Ascension, and supports the Yangon project team in preparing the workshop. So in addition, SICAN mobilized the international experts from its partner organizations, such as IEA and the local stakeholders to lead in the whole process. So the role of the city is to host the workshop and to lead this consultation workshop by the project coordinator and the project team. So the partner organization also play a key role in nominating the international experts to support in this international consultation workshop in Yangon. So in terms of the consultation on the draft 1 to develop the final draft radiotherapy development plan and the quality assurance program. So next slide, please. So hereby, I would like to highlight some key participants from the Yangon city and Myanmar as a whole in this workshop. So such as the decision maker from the Ministry of Health, so Myanmar National Liaison Officer of the IEA, so member of the City Executive Committee of the SICAN Yangon, and also the technical leads or the heads of the Department of the Radiotherapy from all the tertiary hospitals in Myanmar, and the representative of the professional societies and private hospital in this Yangon. So their participation in this workshop is really support in consultation and reviewing of the outputs of this project from the different angles of the perspectives and the context. Regarding the external experts, 2 international experts nominated by the IEA and 1 by our industry partners of the SICAN participated in this workshop. And I would like to appreciate their efforts in supporting the Yangon project team in reviewing and consulting the outputs and in providing the comments and advice as per the context and the resource available of the Yangon city. So next slide, please. Okay, so within 1 to 2 months, within 2 months after international consultation workshop, so the project team worked together to accommodate the advice and the comments from the international experts. So hereby, I would like to acknowledge the technical support and the advice of the international experts. So as listed in this slide, who were nominated by the CCAN's partners, as well as from the CCAN. So in addition, I would like to extend my acknowledgement to the Professor Rolando Alfonso, who is actually nominated by the IEA, and who supported and supported by the CCAN. So who made the final technical review and supported in the development of the final radiotherapy development plan and the quality assurance program under this project. So next slide, please. Next slide, please. Okay. So from the key lens of the Yangon, so CCAN developed and introduced the guidelines, especially how to, guidelines for preparing radiotherapy development plan and the quality assurance program, with the support of the Professor Rodolfo Alfonso, to streamline the similar process in execution of the projects in the other cities. So next slide, please. Okay, once the final products were ready, so the project coordinator submitted the final documents to the City Executive Committee for approval and referred to the Myanmar Ministry of Health and Sports for endorsements. Here, I would like to highlight the importance of the participation of the representative from the ministry as well as from the city as a key factor for successful endorsement of the outputs of these projects. So here is the photos of the final documents of the Yangon. So next slide, please. Okay, so as a next step, so once the ministry approved this radiotherapy development plan and the quality assurance program, so the city approached to the next step of implementation of this plan by publishing and disseminating it to the relevant departments, hospitals, development partners at the city level, and to the international partners at the global level. So to establish the partnership with the development partners or potential investors. So in case of Yangon, so we establish a partnership with international finance corporations for sustainable financial solutions and to plan actions for the key areas of needs in the outputs of the projects. So here, I would like to highlight the ownership of these policy documents by the ministry is a key for successful implementation of the plan. So next slide, please. Thank you. So I would like to share the strategies of the Yangon, for local political buy-in effective implementation of the radiotherapy development plan and quality assurance program. So first of all of our work in this project was conducted in line with Myanmar National Cancer Control Plan. So from 2017 to 2021, and also with the Myanmar National Health Plan. So another highlight is the leadership of the City Executive Committee to mobilize the project team to pursue the endorsement of the Ministry of Health and Sports. So all these documents were submitted to the ministry and has been endorsed by the ministry. So to enhance or to boost the political commitment for the implementation. So in addition, the resources are needed to implement the outputs in the city, and it's needed to link with the financial strategy. Hence, advocacy and dissemination of this plan with the relevant departments and partner is one of the key strategies to allocate the resources. So what is more, we engage with the National Liaison Officer of the IEA and Atomic Energy Regulatory Body of the Myanmar throughout the execution of the project. So last but not least is we put our effort, to involve all the relevant stakeholders, not only from the Yangon, but also from the ministry and also from the other cities of Myanmar. So all of these strategies are expected, to enhance not only for the implementation of the outputs, but also for the sustainability. So this is the last of my presentation. So thank you very much.
Thank you. We are now open for questions and discussion.
Okay, now that was absolutely amazing. So obviously, since 2017, then an amazing structure you've put in place at City Council to get these things out, which is great. So one question then: what problems have you encountered, either at the getting people involved or progressing it further? And what needs what, in some ways, what can the GCR do to help? What issues are there you want to share with us?
I think that I will ask Teco and Professor Kincho to talk about the experience in Yangon. But in general, the problem that we have mainly is that the people are not used to work in that way. Normally, the projects that are in everywhere is a institutional project, organizational project, a scientific society project, Ministry of Health project, but normally it's not everybody involved. So it's the first experience. In many cases, also with the involvement of the National Liaison Officer of the IEA, which is normally do not participate in this type of activities in the cities. At least in the city we have been experienced 7 cities to this moment, and really it's the, in my opinion, the challenge, the major challenge we have is to get them all together and to not to defend their specialty, because also they are competing with other specialties. No, surgery is competing, medical oncology, pathology, everybody is competing, but at the same time they learn to work as a team, as a city team, and the vision is totally different. And then when they progress in this approach, they start to love it and work. Really, we are very pleased the way they have been working in every city. Please take one and show in.
Okay, so I would like to share about the challenges that we encounter in the execution of this project. So the first is the mobilization of the project team, in developing to go along with the methodology in this project. So and as you are aware, the second approach in the city is the voluntary participation of the local stakeholders, in this project. So it's not easy to engage all the stakeholders at the same time. So, but this is the challenge during the implementation of the project. But with the support of the project coordinator, Professor Kim Cho-win here, and also with the City Executive Committee of the Yangon, we have to mobilize together. We have to mobilize the project team to be involved in the technical meetings, workshops. So that's why I would like to appreciate the support, the leadership of the City Executive Committee and the project coordinator in the project. So the second one is we don't have the reference documents or guidelines, how to execute the project at the time of implementation of this project in Yangon. So that's why at the first of the project, that's why Professor Kim Cho-win highlight this. So development of the draft zero is a big barrier in this project, because we don't have a reference document or guidelines how to do it. So that's why, but we have support from the STIC and global teams, who provide the guidelines and international best practice from the IEA. So based on this reference documents, so the project we work together, to initiate the whole process, started from the draft zero to the final draft. So that's the key challenges that from my perspective. So Professor Kim Cho-win.
You're still on mute.
You have to mute. Yeah.
Better.
Yes. As mentioned, Dr. Aung mentioned like that, we have no international expertise guideline, and I also thanks to the Mr. Rolando. He supports me that international benchmarks and many of the IAEA textbooks, and so we learn we learned that about the how to improve the radiotherapy development from the Mr. Rolando's reference books. So this is very much how to say, very much these are the, for me, thank you to the Mr. Rolando, and also Dr. Thet also supports to our department and how to do the how to take the data's collection, and so, and our all of our radiotherapy technology technicians and our medical physicists and our radiation oncologists we all want to develop our department. So we have this will in my heart. So we all are working hard together with Dr. Aung and also under the guidance of the Dr. Rolando. Thank you very much.
I would like to add some smaller two examples. One of the things that also has helping us to create the groups and to make more cohesion in the group, in the working team, is that we have another project that in most of the city has been happening, which is increasing quality, access to quality cancer care, which is done in collaboration mainly with ASCO, but also involving IEA, International Society of Cancer Care Nurses, palliative care associations, and so on, which is integrate the multidisciplinary group. In many cases, sometimes the first time that the radiation oncologists participate really deeply in projects with the rest of the multidisciplinary team, with the rest of the specialty, is in this project. And this also creates a sensation of the group, of the identification of the team in the city. But also, I want to highlight the documents that Teko was mentioning that was developed, because I just said that, but I wait for them to say that. The first things that happen in the city when they trying to do a development plan, despite that there's many technical docs, many documents that you can follow, but is how to do it, how to prepare this development plan of radiotherapy or the quality assurance program. And that's why after the experience in Yangon, it was the third city, it was developed these guidelines on how to prepare a radiotherapy development plan and quality assurance radiotherapy program that we can share. Also, it's not for only for SICAN cities, can be for anyone who wants to, and it was done with the support of the IEA through an expert who was nominated by that, and we recruited for this. Thank you.
No, that's great. And so in terms of now, and I was thinking, it's fabulous work. How do you sort of maximize that now? There's a lot of cities out there. Is it a model whereby, say, one city you've done will do the rest, help with the rest of that country, or is it just kind of expand a lot, or are there links with sort of high-income country departments? What's the next stage in all this to really amplify it? Because there's a huge amount of work there.
I don't know if I got clearly your work, your question, but I have the feeling that I understood. I think that Teko was mentioning in his example how when from the very beginning we are thinking that the project that we develop in the city with the cities, support the city to develop, is a project that is a starting point for expanding in the country, and that's why our intention in radiotherapy is to get that the city project is included, and the radiotherapy development plan that they produce there is included in the cancer control program, as part of the cancer control program. So when they approach the Ministry of Health with that, and they discuss with the ministry, they saw the opportunity for proposing that, and at the end, the ministry approved it. This is the case now in Asunción. They are now presenting the development plan of radiotherapy, which was for Asunción, but as a project for the country. So we are expecting in the next couple of months, I would say, because sometimes these bureaucratic things are taking time. The Ministry of Health will endorse that as a national program, a national project for development plan of radiotherapy as part of the cancer control program. And that is going to happen also probably in Kumasi, and in Cali is in the region because they have more larger states. But this is the way that we are thinking that we can do. And also for the cities who are not City Cancer Challenge, because we cannot work with so many, if they are interested, I think they can access. It will be a way to access. I don't know really yet what is the way, but it will be a way to access to these guidelines. So if they are interested, a country, a city, or whoever can access to that, and it's a tool. It's another tool. I will not say this is the best one, but it's a tool based on the experience of the people who did it.
No, great, and then you can amplify it that way. And just one other thing is that how can you see this in terms of other cities? How is it with the other? You had a whole load of things: surgery, chemotherapy, you know, that type of thing. How is radiotherapy amongst the pecking order? Is it in Cancer City Challenge experiences the one that goes well, or the one that's slow, or how is it amongst all the others? You know, what have we got to learn from the other ones?
Among the cities who has been doing the assessment and established the priority and making the plan, the development, the plan for projects, radiotherapy has been a priority in almost all of them. Only in Porto Alegre was not included as a priority because really they have a good coverage of radiotherapy and they have quality radiotherapy in the city, and they consider they are involved in many things with the radiotherapy issues, but they don't give that priority. But the rest, radiotherapy is one of the priority. And this participation in other projects like training or human resource development or quality cancer care or so, is also enlarged the role of radiotherapy in the cancer treatment, cancer management. So I think that's impacting in this way.
Right, so it'll depend on you, right. Okay, and I'm conscious I'm hogging the ground. People out there who haven't put their hands up, somebody from the IEA, how have you found this for yourselves in terms of getting these things out there? And is there anything else, something like the GCR can help with? Who's oh, there's a lot of people on. Who'd like to shout?
I can have a question, though. Hi, I'm from Electa. I was wondering, how about access to workforce? I mean, we know that's oftentimes and you know, of course, a critical component, and it's also very few. So, how do you know, building those kind of capabilities along the way to increase access to radiotherapy? You know, once you have it in the plan, but then when implementing it.
You're talking about workforce? I didn't get it clear, the first part of the question.
Yes.
It's about the workforce.
The human capabilities in order to carry out the increased level of radiotherapy.
Yes, sure. If you go through the document of preparing the guidelines for preparing the radiotherapy development plan, one of the main things is the most important things to develop not only machines and facilities, but the human resource. So the estimation of the human resource according to the standards that are provided by the IEA are also included in that development plan. Now is to know what is needed now, what is going to be needed in 2 years, 5 years, and 10 years. But also the way to train these people. They have many other projects because there is a project on human resource development, and every project, all of those 10 or 12 that they have, include the human resource development. So how to train the people, if they have to develop new programs, if they don't have, for instance, medical physics is a problem in most of the cities. So how they can train medical physicists without sending them abroad, because sometimes it's a big deal. So these things are covered in not only in the radiotherapy project, but also in other projects related in the whole approach. Yes, that's a very important topic. Not only machines.
Yeah. And can I just ask, what are in talking of machines and industry, what else could the industry do to help?
If you're asking us, I will say immediately, not only to do their work in the proper way, which is ideal, but also to support the cities in the human resource development, because sometimes it's only a few days training when you buy the machine. That's the real life. So really, it's much more, in my opinion, much more need of supporting training for all the specialties, not only radiation oncologists, but also medical physicists, RTTs, nurses, and so on.
Great. Thet Kyung-Aung, you have your hand up.
Yeah, thank you. So actually, I would like to add on about the discussion for the human resource training. So actually, in this radiotherapy development plan, so we describe about the needs for the development of the training program for the medical physicists in Myanmar. So after the endorsement of this radiotherapy development plan, so we introduced the city, identify this needs as a priority, so that the city can support the city, to develop this training program for the medical physicists in Yangon. So this project is currently ongoing. So that's the aware that we addressed the needs of the priorities in the radiotherapy development plan at the time of implementation. So just I would like to add this point. Thank you.
Any other questions from anyone now? Great resource. So one final one, Rolando. So for other national cancer plans, we were conscious, we were talking last session about the European cancer plan now, and how, again, radiotherapy is deep. You start at a high level, and deep down in there is radiotherapy, and then Europe, a lot of countries or whatever. What advice would you have for national cancer plans in terms of their radiotherapy? Is it to start, as you've done, with specialist areas in radiotherapy that can move out, or a top-down approach? At what level do we need to come in and advocate for radiotherapy?
I think that's something that should be answered by the WHO. But in my opinion, I have been working for long in this, but especially in low and middle income countries. So I cannot advise really. I will have to be clear in that. The high income countries, because I have never been in that setting. But in low and middle income countries, the National Cancer Control Program has one task, which is try to focus on what is priority for the country, what they can do, the minimal thing that they can do with the funds they have, having the largest impact. So actions who has impact. And radiotherapy has proved that it's something that has a high impact for any country, in any case, for cancer care. And cancer care is one of the main components, one of the areas of cancer control. So has to be part of that, cannot be ignored, not more, cannot be ignored anymore. That radiotherapy has to be included as part of the cancer control program, and mainly this radiotherapy development plan, because it's in line with the cancer control plan. It's the same objective. You try to establish what is your objective, what you are expecting to get as a result on implementing these actions, and then how to monitor them, how to evaluate it. So the same way, it's very online with the cancer control program.
Really good advice. Great. Look, thank you for that. So then that's been really helpful. So for everybody there, we'll have the slides up on the website. So it's a really good source of information. And hopefully, Rolando will carry on the conversation, see how we can help, and also be really important to see any updates and what else you've learned as you go through. And great job, Myanmar. That's absolutely amazing what you've done. So just to finish off, just from the GCR's point of view, we're having the break over the summer. Then in next term, Shandy is going to tell us about the summit. We've also got Anthony Zeitman, previous president of ASTRO and editor of the Red Journal in November, is going to do a session around advocacy for radiotherapy. We're also hoping to link up with some pharma companies to do a session on immunotherapy and radiotherapy, what we can do out there. So Shandy, just perhaps 2 seconds on the summit from you.
Hi, yes, thanks so much for the time to give this event a shout out here with this fantastic group of folks. As part of AdvaMed's effort to really make sure that stakeholders worldwide are convening and to discuss radiation therapy, we are co-hosting an event with AdvaMed and the GCR titled the Global Radiation Therapy Summit. This will be in September in lieu of our GCR meeting. It'll be 2 half-day meetings or sessions, which I think everybody should be able to, especially in this group, have interest to in most of the sessions. And really the goal of this is to convene first as global stakeholders, which aside from this group, I don't think that's really happened before. And so I think the first step in creating change is convening. So that is the general purpose of this, and we'll be highlighting some keynote speakers and other sessions, which really go from payment and reimbursement to regulatory to advocacy with patient groups and collaboration. So we will be inviting a variety of folks to attend, and you should get the invitation here shortly, as we will be launching registration, and it will be a free registration, and we'll be doing it in the morning hours in the US, so hopefully it's fairly convenient for most folks globally, and then we'll record it and have those sessions available for people to revisit if they're unable to attend. So Pat, do you have anything to add to that?
No, I think that'd be great, and thank everybody for some great work. It's great sharing all this, and thank you. So I think we'll close now, but thanks again to Kansas City Challenge, fantastic job, amazing work for radiotherapy, and we'll carry on the conversation and take care over the summer, and we'll talk again in September then.